Every year in Wisconsin, 25 women die during or within the first year of pregnancy, and 2 out of 3 pregnancy-related deaths happen postpartum due to conditions like severe anxiety and depression and physical conditions like hypertension and heart disease. But access to care is a challenge in Wisconsin, one of the few states that still hasn't extended Medicaid coverage to 1 year after pregnancy, despite bipartisan support. That's why mothers, care providers, and more are urging lawmakers to change that.
She's definitely the best thing to ever happen to me.
Holly Ott's daughter, Nala, is now 6.5. They've bonded over their strength ever since Nala was born. Holly struggled with postpartum anxiety and depression.
My most daunting fear was leaving her alone, and that even if I went to a different room and went to the bathroom, or if I took a shower and she was in her bassinet, she would, stop breathing.
She was on Medicaid for 60 days after Nala was born and found help and support that lasted after her coverage ran out.
But I'm also against the norm. That's not a thing that a lot of people have.
And that's why she's joining others in pushing the state to extend Medicaid coverage to 1 year after pregnancy. But the bill allowing that to happen was just stalled in the Assembly after passing the Senate. When asked about it last year, Speaker Robin Vos said the state, quote, gives away too much free stuff.
Very frustrating because there's bipartisan support. So here's something that both sides of the aisle see and agree on, but then you get a few who just say, we don't want to give away things for free.
Sarah Bloomquist is the founder of Mom's Mental Health Initiative to provide peer-driven support and resources.
If you can't access that resource, then what good is it to even dangle that hope in front of someone and then take it away from them?
She says not expanding Medicaid costs the state millions in the workforce, income, and caring for the mother and child going forward.
And the potential for relapse or for going backwards is very high.
We have had people to come in and utilize this space.
At the Harambe Birth and Family Center on Madison's east side, almost all of doula Chandra Lewis's clients are on Medicaid or Medicaid eligible.
They're not sleeping, they're not eating, they can't afford their medicine, so they aren't taking their medicine, or they need to go to a doctor to have whatever medicines readjusted.
Black and brown mothers face even higher mortality rates in Wisconsin. Extended coverage could help change that.
Doulas aren't a magic bullet. Doulas don't save everything, but we do just step in where we can. It's not sustainable.
Holly now works with other mothers to bring awareness that coverage should be extended, with Nala by her side.
We are both go-getters, very independent. We are, I think there is power in womanhood.
And that bill that Speaker Vos opposed was co-signed by more than half of the Assembly's representatives. It now won't be taken up until the next session.